Myself, Dr.N.Deepthi Shetty, Clinical Administrator of Image Hospitals and founder of Exam Academy, practicing since 15 years. So definitely there are different types of pigmentation concerns like hyperpigmentation, melasma, acne spots, freckles, sunspots or UV spots, depending upon their skin tone and the depth of the pigmentation and the types of lasers which can be used, and the procedures can be customized. So we have different lasers like Indiac lasers, Q switch lasers, diode lasers and other lasers which will definitely help to reduce your pigmentation. When combined with the home care routine along with the sessions, definitely you can see very good visible changes. The sessions, when it comes to how many number of sessions are required, minimally 6 to 8 sessions, it may go up to 10 sessions depending upon their skin type and the depth of the pigmentation and how about their routine, how do they follow and all. Depending upon that, minimum sessions required will be 6 to 8 or maximum 10 sessions required. So the pigmentation concerns definitely recurs back if it is not properly maintained with the regular skincare routine and a good proper maintenance with the sessions and the maintenance sessions as well. Why? Because the superficial spots can be permanently cleared. When it comes to deep spots and hormonal changes, pigmentation and melasma conditions and all, the chances of recurrence is definitely there. It has to be maintained with the maintenance sessions and a good skincare routine, as well as maintaining your hormonal conditions. For example, if they have with the thyroid levels in huge variations and as well as in the PCOD concerns, definitely the chances of getting the melasma is definitely there. So in that condition, they have to definitely follow with the maintenance sessions as well as with the home care routine to give good visible changes and the long lasting results. So the chances of recurrence is more seen in people with more of the genetic history, as well as with the lots of the hormonal changes happening in the body and more exposure to sunlight, or their work routine will be more exposed to sunlight. In that condition, the chances of recurrence is more compared to the regular people. So definitely there are some drawbacks even with the laser, because the minimal side effects definitely is a common, which includes with mild redness and swelling, and even the sensitive areas in the skin may turn out, and post-inflammatory hyperpigmentation is one of the thing which is definitely a drawback when the laser is not properly done with a good intensity. Based upon the skin type, the intensity and the frequencies has to be changed, because the post-inflammatory hyperpigmentation is more obviously seen in darker skin tone people compared to the lighter skin tones. It depends upon the procedure is done with how much intensity and how obviously it is done in a perfect way. Based upon that, even other less common side effects will be hypopigmentation as well, but it's rarely seen in only few conditions, and it may leads to burns as well if in the darker skin tone people, if it's not properly maintained with the sophisticated technique, they will definitely end up with burns as well. But these are not too much complications because of the recent lasers work with the both heat and cold technology, which will subside with all the things. So definitely maintaining with the appropriate cooling techniques in between the procedure along with the laser definitely will minimize the side effects. A lot of people ask regarding which is better for pigmentation, either with the creams, home care routine, or with the chemical peels or laser. Definitely creams are the first line treatment, which includes with your hydroquinones, retinoids and other mild acids. Definitely it's a first line therapy to reduce your pigmentation. And when it comes to chemical peels, it's also a definitely very good option along with your skincare routine. Definitely like glycolic acid, salicylic acid, TCA peels, which will help to reduce your pigmentation up to a very good extent. So based upon the damage, the series of number of steps and the depth of the peel can be customized so that your pigmentation can come down. And when it comes to resistant pigmentations, the lasers are a very good option. Only thing is like with the lasers we have few drawbacks, post-inflammatory hyperpigmentation concerns and mild burns. Because of that, it has to be carefully done, and in a very good practitioner and a supervision, it has to be definitely taken care with. So definitely in the first line treatment, creams is a very good option, followed by with the chemical peels, and in the tough end and the resistant pigmentation, choosing with the different lasers, some Q switch lasers, Indiac lasers, definitely helps you to very good extent. And when it comes to other conditions, you can even choose with the ablative lasers as well as the second line of therapies after the basic procedures.